All right, welcome everyone. Thank you so much for joining us. My name is Katie Freeman, and I'm the Manager of Programs and Community Engagement for the Northwest chapter of APDA. Unlocking Strength Within is APDA's webinar series on the emotional and psychological aspects of living with Parkinson's disease. And today we've got a really exciting panel discussion all about social isolation and emotional health. Before we begin, I do want to give you a heads up that we may be touching on some tough topics today. That includes depression, substance use, and possibly suicidal ideation. I want you to be sure to take care of yourselves while you're watching today. So take a break if things feel a little too heavy. This session is going to be recorded, so you can always come back and watch later. We're not going anywhere. Okay, I want to start by introducing our wonderful panelists. First up is Dr. Karen Torres. Karen is a bilingual, board certified neuropsychologist at the University of Washington's Memory and Brain Wellness Center here in Seattle. Her interests include improving the quality of care for Spanish speaking individuals who are experiencing neurodegenerative diseases and working collaboratively with communities to improve brain health. Thanks for being here, Karen.
Thank you for having me.
Next up is Maureen Feldman. Maureen is the director of the Social Isolation Impact Project at the Motion Picture and Television Fund in California, and she's the founding chair of the Social Isolation Impact Coalition. She's an authority and advocate on issues facing the aging population, and she regularly presents on the positive impacts of social connectivity, the necessity of technology, and cross generational mentorships. Welcome, Maureen.
Thank you. Thanks, Katie. Great to be here.
Okay, and then our last panelist is Brian Rufert. Brian was diagnosed with Parkinson's disease in April of 2017. And this was during a time in his life where he was working full time and doing outreach ministry. In the summer of 2018, Brian experienced some mental health challenges that left him with many questions, concerns, and fears. And working through these were a struggle. In August of 2022, Brian began to make significant changes to his mental health and Parkinson's management. For the past 2 years, he's continued to educate himself about Parkinson's and find the courage and hope to reach out to others within the Parkinson's community. Brian's mission is now to help others find hope within their lives. Thanks for being here, Brian.
Thank you, Kim.
And for all of you panelists, I really appreciate you making the time to be here and having this really important conversation. My first question today is for Maureen. So, Maureen, can you tell us a little bit what we mean when we say social isolation? Why is that so important for us to be talking about?
Sure. People often confuse social isolation and loneliness, but experts define social isolation as the state of having limited or social interactions or minimal communication with others. While social isolation can affect anyone, it's particularly concerning for older adults or individuals with chronic conditions, because the studies have consistently shown that social isolation can lead to a range of adverse effects like cognitive decline, increased depression, anxiety, and reduced quality of life. And in some prolonged instances, it can even end up in a higher risk for mortality. So it's really important that we're talking about this today because it really is a hidden epidemic that millions of people are actually suffering from, particularly the Parkinson's community.
Great, thank you so much. Karen, Maureen mentioned the health impacts of social isolation, especially when it comes to our brain health. Can you tell us a little bit about what social isolation does to our brain and how that affects brain health?
Absolutely. And so, unfortunately, social isolation has been demonstrated to negatively impact the brain in ways. As a neuropsychologist, my interest is to understand how the brain manifests into cognitive and maybe emotional difficulties And social isolation, for example, from the emotional side of things, has been associated with increased risk for developing depression, anxiety. Within depression, some people may become extremely lonely, and may exhibit symptoms of, extreme sadness, feelings of guilt, but also perhaps irritability and anger.
Mhm.
Anxiety, on the other hand, can lead to, just feeling a general sensation of feeling nervous, on edge, unable to relax, and for some people, it can become physical symptoms. So, social isolation can definitely impact one's emotional well being. It can also impact your lifestyle choices. We know that people who are socially isolated may be more prone to perhaps engaging in regular alcohol use, smoking cigarettes. Perhaps nutrition isn't where it should be, and especially in the Parkinson's community, it may be that there's because of limitations physically, they may not be able to go to the grocery store to pick up fresh foods or have someone to help them or help them cook. And so the physical symptoms or lifestyle choices can affect eventually your health, in that engaging in these activities can lead to increases in blood pressure, cholesterol, and diabetes, all of which can negatively affect cognitive function. And so, cognitive function is one's abilities for short term memory, for example, attention span, and language.
Hmm.
And and having persistent social isolation has been associated with an increase of cognitive decline in up to 50%. So your risk can be up to 50% for cognitive decline. And why does this happen? Well, there's a few hypotheses out there that have suggested that the chronic state of stress in people who are socially isolated can lead to inflammation, for example. And inflammation is not good for the brain and can eventually lead to cognitive changes. In the brain health world, when we're interested in understanding what can we all do, and certainly people who are getting older and people who have neurological diseases like Parkinson's, what can we do to keep our brains healthy? We know that activity has been repeatedly shown to keep brains healthy. Physical activity, cognitive activity, but also social activity. So if you're socially isolated, your engagement in what probably one of the most important recommendations to keep your brain healthy is decreased. And so we need to make sure that that isn't the case.
Great. Thank you so much, Karen. That's so fascinating that
Mm.
there's a combination, right, of both physiological changes that might be happening in the brain, but also social isolation has a big impact on how we act, which in turn impacts our health outcomes. Thanks so much for explaining that to us. Now, Brian, I wanna turn to you now. Let's talk a little bit about your diagnosis of Parkinson's in 2017. How did receiving that diagnosis, how did your experience of having Parkinson's impact your connections and your relationships with other people?
My diagnosis in 2017 came from me not being able to get off the couch early in 2017, and I just thought I
Mm.
was overweight. And so when I went to my doctor and he was concerned about it, um, the week later, he told me to go to the hospital. And so my diagnosis came from 4 days in the hospital, every test I've ever been through,
Wow.
MRIs, CAT scan. And then on day 4, they said, we think he got Parkinson's.
Wow.
And so mine was, wow, what and what now?
Mhm.
And I had a full-time job, working as a dispatcher in a call center, one of the busiest in the nation, and doing full-time ministry, marriage, raising a kid. So they told me that medicine would cure it,
Mm.
or
Mhm.
help it.
Mhm.
And so that's what I thought Parkinson's was. I didn't take it serious.
Right.
And now I know I was in a form of denial.
Mm.
And
Mhm.
so I went back to work. And so my connectivity, I had a very good support system. It came over the next year and a half. And
Mm.
it started with, I have a great doctor, Dr. Lena Fine. great neurologists and stuff, Dr. Tarabilla that went east, and my other doctor, Eric Gill. I had a great team. And so she had to take me off my medication, my mental health meds. And anybody knows that I don't want to be on meds in the first place. So she had to take me off those and match them up to Parkinson's, because meds have to match Parkinson's.
Sure.
Now, this is all stuff I've learned in the last 2 years, but now I know why she was doing what she's doing. And so I went through a moment of depression kind of symptoms then, probably about 2 months in, 3 months in. And then my decline happened. I started getting tired, fatigued. And I thought I was just doing too much. So I cut back a little bit, but I had no strength. I had no drive. So my drive was gone. And I didn't know that there were 10 million symptoms with Parkinson's.
Right,
I didn't know
right.
there was anxiety. I didn't know there was fatigue. I didn't know that anxiety, that's what I was on meds for.
Sure.
That you can have that with Parkinson's. So what happened was that I started getting tired. I started missing appointments. I started not wanting to go to appointments, canceling appointments. And then I started making mistakes on my job, ministry, everywhere I go. My reasoning was off. And so back then, none of us were educated.
Right.
And so what happened was next, I started feeling bad about myself. So now the decline happens where I was feeling bad about myself. I was feeling guilty. And then I kept making mistakes. And you're at a prestigious place in the community doing outreach. You start hiding with stuff. I did. I mean,
sure.
Now that I'm in the Parkinson community, I found out that that's what we deal with is how do we deal with things? So we hide. And so I didn't isolate so much here, but I isolated inside. All right. And so I started hiding, and I talked to, Dr. Fine was the one that really understood it along the way. And she worked with me. But what happened was that all of a sudden I had 18 years sobriety, 17, 18 years sobriety at that time, drugs and alcohol. And all of a sudden I was having intrusive thoughts or negative thoughts, crazy thoughts, drive your car off the freeway, find a place to do that. And I just thought that, hey, that was the old stuff. So I was dealing with it. And then all of a sudden my mind I lost it. I started taking, I don't know the word, but when you started taking scripture and just obsessing with God don't love me, everything in my life became negative.
Right.
But I was here and I couldn't talk about it. All right. I couldn't talk about it. I felt shame for getting a therapist.
Right.
And it was like my whole brain locked up.
Yeah. And Brian, I think your story really shows the complexity of this and how Parkinson's, impacts our ability to connect with people. For you, it was a combination of some medication changes that affected your mental health. It was some difficulties with your job. It was some, issues with faith, that caused you to question things. A resurgence maybe of some, addictive behaviors or thoughts. All of that combines to make it so it's so much more difficult for you to reach out to people, to ask for help, to connect and get that support that you needed. And I think you said something really important there, that you withdrew in your mind. And I think for a lot of us, we may be surrounded by people all the time. We may have interactions with people, but we still feel that loneliness. We may still be isolated, even if there are people in our lives. We can withdraw into our brains. And, it's important to recognize that as well. So thank you, Brian, for sharing all of that. I know it's not easy.
You're welcome.
Maureen, maybe we can go back to you a little bit. Brian's described this isolation that he's starting to or had started to feel. But why are people with Parkinson's at a higher risk of becoming socially isolated? What are some of both the structural factors and the interpersonal factors that increase that risk?
Brian, articulated so much of what he experienced so beautifully. And the first thing I want to talk about is social isolation and loneliness, it impacts everyone. In fact, studies have shown that about 30% of people identify as being socially isolated. But for the Parkinson's community, it's double, it's 60%. And a big part of that is that interpersonal factors, the stigma and misunderstanding, and that Brian so well articulated. The individuals that have Parkinson's diagnosis, they often experience, not all of their symptoms are visible in nature, but they might have stiffness or tremors. They don't understand what's going on with them. He had mentioned mental health challenges like depression and anxiety and even apathy. So reaching out to someone, they will often withdraw thinking, well, when I get better or feel better. But what happens is as the physical limitations are added to that, relationships sometimes change, they sometimes want to be more independent, and it impacts their ability to reach out. And then structurally, you've got mobility limitations. So maybe they stop driving, and that makes it harder for them to socialize or go to events. Communication barriers, language or slower speech. They might have embarrassment. And then sometimes there's fatigue and other fluctuating symptoms. So all of those combined can make it very challenging for someone to engage in their normal social activities. Friends and family often don't know what to do, and they're waiting to be told what to do. And again, it's so good that we're having this conversation because we'll talk about later how to support someone with Parkinson's. But, for the individual who's got mobility challenges, possible cognitive decline, and mental health challenges, it's hard for them to be able to tell others how to help them.
Right.
But those are structurally some of the reasons and the interpersonal reasons why people withdraw. But I would really say that stigma and misunderstanding is one of the important factors that we should think about and remember when we're trying to help our friends and family and community members who have Parkinson's.
Right, absolutely. And I'm so glad you brought up apathy too. Often I hear from caregivers or loved ones of people with Parkinson's that, that they're recognizing apathy in their loved ones, but they don't realize that sometimes that means that their loved ones with Parkinson's are not going to ask for help because of that apathy or are not going to reach out and ask for that connection. So being able to recognize that on the outside, I think is really important.
Yeah, we can't put the onus on the person who's experiencing the symptoms. We need to take action without being invited.
Yeah, absolutely. All right, Karen, I'd love your kind of clinical perspective on this too. As a clinician, when you're seeing a patient, what are some signs that they might be socially isolated or at risk of becoming isolated? And in your role, how do you respond to those signs?
Sure. So, as a neuropsychologist, I ask a lot of questions about, their emotional well-being. Currently, how are they feeling? Are there, I don't just ask, are you depressed, right? Because there's a lot of symptoms under that umbrella of depression. But I want to know what is going on with them internally. How do they know they're depressed? What are they feeling? What symptoms specifically? Is it sadness or is it irritability, having a shorter fuse than normal? Is it apathy? And depression and apathy, they have a lot of overlapping symptoms, but they are distinct conditions. And so by asking questions, I get a sense of, in the here and now, what is currently going on and how severe is it? How much is it impacting your everyday life? Are you staying in bed versus getting up in the morning and showering and going on with your day? Is there more conflict with friends and family members because there is the more frustration in just everyday life? But certainly, I'm interested in getting a sense from people what they do in what's a typical day like for them, or what's a typical week. And I ask those questions because it gives me some understanding of, okay, how socially connected are they? Right. Are they do they spend most days at home watching television by themselves? Or Are they watching television, but they invite friends over to watch television with them, and they have, social interaction and communication? Are they, staying most of the day at home because there is really no one else around them that can help provide emotional support, physical support? Or is it their physical limitations from the Parkinson's that is keeping them inside? So these are the types of questions that help kind of clarify, okay, what is someone's social circle like? And if given the opportunity, I like to work with patients to try to develop a realistic plan for increasing socialization. And when I say realistic, what I'm really trying to get at is what is meaningful to the individual. Because what is meaningful to one person may not be meaningful to the other person.
Sure.
So I'm trying to get a gauge of what is meaningful in your life. What do you deem important? Because that, by asking that question, it can lead into better insight into potentially where their interests lie.
Right.
So I can recommend, join a support group via Zoom or in person. But if someone says, you know what, I'm not interested in talking about my illness with other people just yet, me recommending a support group wouldn't be appropriate. It's not going to lead to any actionable items. Versus if I have a patient that says, you know what, I've always wanted to learn how to play the guitar, but I don't have resources to do that, right? I may have a guitar, but I can't hire a teacher, for example. Well, I may suggest, let's get on YouTube and try to find lessons that maybe you can learn in that way. So it's about learning about what the individual experiences in day-to-day life that can lead to a realistic expectation of how to improve socialization in their lives.
Right. So it sounds like being really proactive with those questions is so important. And it made me think, as a patient, we may not recognize that we are depressed. We may not recognize that we're socially isolated. So it's so important to ask those questions. What do you do in your day to day? I love that. And then just the importance of developing that relationship with your patient so you can offer very individualized and very personal recommendations for how they can, become more connected and find that healing. I love that.
Absolutely.
Thanks, Karen. All right, Brian, back to you, my friend. So when you recognized when you were isolated and dealing with mental health challenges, you described that process of kind of decline after your diagnosis of becoming withdrawn. What resources did you turn to once you recognized that? What helped you process your emotions and get back into community with other people?
It's real important for me to add this, and this part of my story is that when I declined, I tried to commit suicide, attempting suicide. And so after that, getting back, I never got back to a place of stability from 2018 to 2022.
Sure.
I even voluntarily called Dr. Fine and said, get me into a hospital. It's happening again.
Yeah.
So I learned from before that I just knew something wasn't right. So in July of 2024, I started using drugs again out of my depression. I just didn't know how to deal with it.
Sure.
And so the first thing I did is I got into a treatment center. But it's important because when I was in the hospital, I said, I need one with mental health. And I need one that's going to somebody. So it is out there. It's important for me to say that. I got into Hotel California, and they helped me to connect back up with my doctors again. I was in pretty bad shape physically because of the Parkinson's and mentally, and they helped me connect back with my doctors. I got a therapist. I was in a place and I had an attitude of, I got to figure out what happened to me. All right. Because I knew it wasn't me. So I finally came to a place in my mind that wasn't me. Something else was wrong.
Sure.
So where else could I turn? I called APDA. APDA. Is that right?
Got that. Yep.
I did it. Took me 25 years.
You called us.
Yeah. I called them because I called them in the beginning and I said, hey, and from there, I began to educate myself. And when I began to educate myself, it was like the connectivity strengthened because I found out I wasn't crazy.
Yeah.
There was
Yeah.
these other symptoms, and so they connected me with that. And I got to put this in. When I got diagnosed, when I heard the word exercise, I just about passed out because I hadn't exercised my whole life.
Hmm.
So I'm like, oh my, let me avoid that for now. And so I got into bowling. And as you know, I am a avid bowler now.
Hmm.
And that has really saved my life. The doctors are happy about it and amazed, that I can bowl. Concentration's not so well sometimes and stuff, but I got into a group called Flying Solo, and I get on there and there's people up there, 65, 70, 80, 90. I'm the youngest guy at 53, but I stayed and I love the group. I look
That's
forward
great.
to it now, but it took me, this is very important. It took me 2 years, a year and a half to get in that group.
Hmm.
So I had to fight through. I know it's better. I know it's better. I know it's better. They introduced me to YOPD. I went to a conference, and I met some neat people. And I still deal with social isolation.
Sure.
All right. I still deal with that heavily. Okay. Um, real heavily at times for multiple reasons. And
Sure.
so I
Sure.
still fight through that. But education and then Instagram, I try to find that has been a blessing. I've got friends all over the world, and I find out that I listen to their stories. I cry a lot now because what I went through was not me, and I lost a lot as a result
Yeah.
of that because nobody knew what was going on. They thought it
Sure.
was old Brian just
Yeah.
being a drug addict again. That was the
Hmm.
biggest thing, and so it took me about a year and a half to work through guilt and shame.
Yeah, of course.
I had a lot of guilt and shame, and so but the community, and I know I am now exercising. I got a Dr. Riley Duffy. I hired her. I got a personal trainer, and I've been with her 4 months now, and I'm starting to feel good.
That's great.
Yeah. So it's
I'm
good.
so I'm so happy to hear that, Brian. And there are a few things that you said that I really want to emphasize. First, thank you for sharing your experience with suicidal ideation, right? We know that that is super common for folks with Parkinson's to contemplate suicide. And I don't want to say that to scare people, but to let them know that you are not alone in those thoughts, that there are a lot of us out there who, are thinking about those kinds of things. It's scary, but there are so many resources out there for you. And sometimes it just takes stepping up and saying to your doctor, saying to a loved one, "Hey, I'm having these thoughts and I need some help. I need some support." And I really appreciate, Brian, you kind of telling us how you did that, how you really realized, okay, I need treatment. I need to get to a medical setting where I can recover from these feelings, these emotions, and really, really take care of myself. I'm glad you had that medical system around you to provide the care that you need. And then you talked about a little bit about the Parkinson's community, right? So that flying solo support group, which is a group specifically for folks who, are living alone, who don't have a care partner, who are taking care of themselves with Parkinson's. It's great that you have that community around you. And then here in the Northwest, we had a conference for folks with young onset Parkinson's disease last October. And it sounds like you got a lot of support from that as well. So finding these spaces with people who understand what you're going through can be so meaningful and can be so helpful towards that recovery. Thanks for sharing, Brian.
You're welcome.
All right, we've got a couple more questions before we turn it over to the audience. Maureen, back to you. So thinking about, we just discussed some of the barriers, right, that a person with Parkinson's may face due to their condition. Thinking about that, what are some accessible ways for them to become more socially connected?
Great. Well, thank you. And both Karen and Brian talked about different options. And I think the first thing we have to discuss is to destigmatize the issue. We have to destigmatize being socially isolated. There's nothing wrong with being socially isolated. Millions of Americans manage mental health conditions, and we talk about that openly. We have to talk about social isolation. It can happen for a lot of reasons. You can become retired or lose your driver's license, or maybe, you know, a chronic illness. So there's a lot of reasons why people become socially isolated. It's not just the Parkinson's community. But like Karen said, some people might not be ready for a support group, which are wonderful and they're a great way to socialize. But you can join a social group, as Brian did. Bowling turned out to be a great way for him to both be physically fit and socially engaged. But there are now thousands of online platforms. If you're unable to drive, if your mobility issues get in the way, these online communities, you know, you get to know the individuals, you can connect that way. I think it's important for community to continually offer these online and in-person programs, everything from Tai Chi and Qigong, gentle yoga, movement, because we know it's good. But music is known to be really important and impact the brain, and it brings people together. So socializing, I'd say everything we do should have a social component, a time before where you get to know each other. If you are hosting online programs, do breakout rooms. Give them an opportunity to meet someone, to try to remember their name, to connect with them. But I think that, like you had said, we can't keep putting the onus on the individual that has the issue. So if you are providing educational or social opportunities, include the communities, destigmatize it, open it to everybody. It doesn't have to be just a Parkinson's community. And again, feeling as though you have to hide it or manage your tremors or even your language issues, use the chat. I think we have to overcome these barriers as they come up one at a time, because, you know, again, you might have one and then another one shows up, but don't disengage. Social engagement will probably be one of the number one positive steps you can take to keep yourself socially connected, but to keep that depression and that anxiety also reduced, and to help manage, you know, this process, however long it takes.
Thanks, Maureen.
Mm-hmm.
Karen, I have another question for you. You know, Brian described, you know, when he got to that really, really dark place, reaching out to his medical providers for help. And I'm curious, in your clinical experience, you know, how can someone start a conversation with their doctor about their mental health or about their lack of social connection? What kind of questions should they be asking their doctor, and what kind of care can they expect from their medical providers?
Sure. You know, talking about mental health issues can be there's a stigma with it, right? And then you add on top of that the Parkinson's disease, it can be a very hard conversation to start. And then knowing how to start this conversation. So what I often tell patients is, if you are already working with a Parkinson's disease provider, chances are that the symptoms that you have questions about or are wondering about, they've already had a patient who has similar symptoms, a similar story, and so they have that experience. A strong recommendation that I give is, prior to your appointment, or if a phone call with your provider where you're going to talk about these issues, or you want these questions and issues to be at the forefront, is to write things down. You know, people with Parkinson's, at times, because of maybe slower speech, attentional issues, when they're asked questions in the spot, it may be challenging to come up with specifics and examples, because doctors always want examples of what you're trying to share with them. And so writing down as much as you can about your symptoms, examples of your symptoms, or, when are the symptoms present? Is it early in the morning? Is it late at night? Is it all day? How many days of the week are you feeling this way? By writing these things down prior to speaking with your doctor, it helps clarify to you and give you a better understanding of the scope that you're dealing with of these symptoms, and can make your meeting with your provider all the more fruitful, because you are there with information, with specific questions. Doctor, does this mean I have to take antidepressant medication? Does this mean that I have to go to the hospital? What does this mean for my family? If you can write down those questions ahead of time, it can make it a much more meaningful experience. And that's to say that, if you share all of these symptoms or these difficulties that you're having, it doesn't necessarily mean that your doctor is going to say, oh, you need to get on medication. Medication is not always the first answer to these type of questions. Your doctor may say, well, when was the last time you checked your thyroid or your vitamin B12? Because we know that deficiencies in these areas can lead to depression or anxiety, right? So they may suggest, let's do some lab work to make sure there's no, medical issue that is causing these symptoms to show up. They may be familiar with counselors within their own clinic or medical setting or in the community who have expertise in working with Parkinson's patients, and they may suggest, let's give counseling a shot, either individually or group counseling. They may make recommendations for medications, of course, if they think it's appropriate. They may have a social worker who works in the clinic or medical center with them, they can refer you to for resources, not only through the community, but APDA, for example. But I think it's important to understand that even though it's difficult to bring up these issues and talk about them maybe for the first time, you hopefully will have providers who have the experience of working with PD patients who have these symptoms, and being prepared with being able to describe your experience of what's going on prior to meeting with your provider can be very helpful.
Right. Thanks, Karen. And I think a lot of folks with Parkinson's are familiar with the idea of symptom tracking, right? Especially in terms of our movement symptoms. But remember, tracking your mood too is just as important, and talking about with your doctor. That is just as worthy of your doctor's attention. Thanks for walking us through how that might work in a doctor's appointment, Karen. All right, Brian, I've got one more planned question for you. You and I have been, over the past couple of months, talking about a group that you wanted to form that you're calling PD Plus. Can you tell me a little bit about this group and why it's important to you?
Yeah, about 5 months ago, I don't know, I was sitting in a support group or online, and first, like I said, there's no bad support group. A support group is there to help you get things off your heart, your chest, all right? And if it doesn't fit, you find one that does. I got to say that first. And so I Googled and I looked for support groups that with people with mental health issues and Parkinson's, addiction areas, social isolation, impulse control, all right? And then began to talk to people on Instagram, and they said, I don't know, I don't know of any, that is just dedicated to that. And so it came up to me to went to you and I said, hey, is it possible to maybe start a support group for people that had pre-existing conditions, coming in? Because it's one thing to get diagnosed with Parkinson's, but it's another thing to get diagnosed with Parkinson's and you got bipolar, all right, you got social isolation and you got addiction issues. That can be very hopeless. And so the name Parkinson Plus came to my mind and starting a support group. And so last month, I told Katie, I think it's about time. I found a couple other people that would help facilitate it, because, we are good at canceling things, or we're having bad days. We need some backup people.
Mhm.
And
Mhm.
so, and that's my heart. It's just to find hope, and that's the community one of the communities that I want to help. Especially coming from that background. It's just going to be a group. You come and share where you're at that day, and if you want feedback, then someone will give you feedback. No one's going to control a group. It's just there for support, and then from
Yeah.
there, we can go from there. If somebody needs help.
That's
Yeah.
wonderful, Brian. And I really appreciate you, seeing a gap in services, recognizing that there is a need for this kind of support for people, with Parkinson's who have these other, issues going on with their lives, and saying, okay, I'm going to be the one to start this.
Mm,
I think that kind of community organizing and finding and creating those spaces for yourselves is so important. So
yeah.
thank you for doing that work.
Yeah. Yeah. You're welcome.
Okay, folks, we are getting to the end of our time here. So I want to make sure we have some audience questions. Um, we got lots and lots of your questions. I was told that already about 100 were submitted before we started the program today. So we're gonna go through a few. Let's see. So one of the questions that was submitted is about anxiety, and how do we mesh not being socially isolated with the anxiety that can come with Parkinson's? How do we overcome that anxiety and maybe some social anxiety as well to get to a place of connection with other people? Brian, do you want to tackle this one?
Yeah. Yeah. I'd be glad to. It's not easy. I've never met anybody that just popped up and say, "Oh, I did this," and I went here, and
Hmm.
you know, um, we put a lot of pressure on ourselves. All right, in one thing, and I can blanket this over anything that I heard it, and it popped in my head. I heard it one day, and is with anxiety in anything we deal with, okay, but anxiety especially because you'll have internal tremors with it too. And that's a hard thing to just discern. Is it internal tremors? Is it anxiety? Who cares? All right, that's my motto. It's something. All right.
Hmm.
And the word is baby steps. What I have
Hmm.
found that works for me, and I pass it on to other people, is that I've had to readjust my whole life. And I could run, I could do different things in baby steps. What is a baby step that I can do? All right. What's a baby step that I can do with exercise? All right. How do I get past this? Is there's always a baby step of something I can do. All right.
Hmm.
Or even, and one of the do's is breathing.
Right.
All right. One of the do's, and I wasn't a meditator. All right. I
Hmm.
wasn't that, but through the Parkinson's community. All right. Okay. I found out breathing helps. And that's a baby step because if you
Right.
can't breathe, then we all got serious issues. That's what I found out. And
Hmm.
those are things I don't come up with my new comedy. No, but it's serious. If I can't breathe,
Hmm.
I'm like, oh, okay. Let me breathe it out.
Right.
And I've heard this all my life, breathe.
Hmm.
I've been in therapy or off and on since 2000 or 1995, and
Hmm.
you hear it different places. So breathing really helps, but trying to find in baby step. And it's okay to cancel. It's okay to cancel an event. It's okay to
Right.
cancel something, appointment you had. You're
Hmm.
not a bad person. All right. So those are the two things: is I'm not a bad person, but also baby step.
Thanks,
I
Brian.
can't. Yeah. So that's it. Go ahead.
I think that's important, right? Find the little things that you can do, right? It's not
Mhm.
just I'm socially connected or I'm socially isolated, right? We can take small steps to get from isolation to connection. We can take a deep breath and then talk to somebody, right? So it's important to recognize your abilities, the energy that you have, and take that small step forward. Thanks, Brian.
Mhm.
Now, I've got a question from a caregiver, and we know that Parkinson's doesn't just affect the person with Parkinson's, but their caregivers, their loved ones as well. And this person asked, what are some good ways to avoid social isolation as a caregiver, especially, if my loved one with Parkinson's is resistant to social connection and engagement. Maureen, do you have any ideas for this one?
Yeah, I do. So I actually facilitate two groups for caregivers, and they're not support groups, they're social groups, and they're online, and they started during COVID. And the reason is if you are a family caregiver, so we're not talking about professional caregivers, we're talking about family caregivers, you're often doing everything you can to assist your loved one, make their lives comfortable, often, taking care of their food needs and other things like that. And the time slips away, as do your social connections, as do your appointments with your own doctor and your own friends. So, the first thing I would say for any caregiver is to create those times in your schedule for yourself. In nowhere does it say that a caregiver should completely, put their own life aside and dedicate everything to the person they're caring for. Find a friend, find another family member if you're the person you're caring for is unable to be alone, but to make sure that you keep up your own social connections. Make phone calls. If you have to do it online through a Zoom group or a video chat, that's okay. Online exercise. So, I mean, you don't have to physically be there, but if you can, make that a priority. And it's the first thing to go. I mean, we say we don't feel like exercising, I'm going to give up my gym membership, or oh, I can get to my doctor later. But many caregivers end up with their own medical conditions and diagnoses because they ignore their own care. So I'd say put yourself on that list, at the top of the list, because you'll be a better person, better friend, better, spouse, partner, but you'll be better to yourself. And again, we often are so afraid of the stigma, we don't share what we're going through. So engage your friends and family, let them know that you could use a little help. People want to help, but they don't know what to do. So you say, you know what? I'd love to take an afternoon off. Can you come and sit here? Can you bring lunch? Can you take my, partner out for a walk or to the park? So be clear, make a list of the people that you can count on. But as Brian said, take action. It starts with a breath, then it's a step. Maybe it's joining something, maybe it's calling a friend, but take action every day to help support yourself, because social isolation creeps in. And once you're in it, it's really hard to figure out how to climb out. So take some kind of action every day, and don't feel selfish. It's imperative.
Yeah.
Thank you, Maureen. I want to take one more question here. How does a person with Parkinson's dementia become more socially connected, especially when they're having difficulty with word finding and formulating thoughts? What kind of options are there for those folks who are dealing with dementia to find social connection? And maybe Karen, would you be able to address this?
Sure. So I am aware through the APDA and other local resources that there's specific programs for people who have dementia, whether it's a social group or a support group. Those do exist. Something else that is important to consider is just because someone has dementia doesn't necessarily mean that they cannot participate or share in their desires and their interests, right? So I think continuing to ask the individual, what are you interested in doing today? What are you interested in engaging? Do you want to call your brother this afternoon and talk to him? It's been a while. Or do you want to go out to, have an early dinner, at a quiet corner in a booth, just you and I, or we can invite someone else to join us? I think it's still important to consider the person and the person's interests and desires, even though they may be, slower to talk or slower to respond. Interest is still there, and it should be respected.
Absolutely. Such a good reminder for us. Karen, that, sometimes our loved ones with dementia, they might require a little more prompting to become socially connected, but that, they still have the ability, right? And that could be, it may not just be like one-on-one conversations. It may be, we're going to take a dance class, or we're going to join a singing group and find other ways of connecting that are a little more accessible to folks with dementia.
Yeah.
And I know here in the Seattle area, there has been a lot of effort put into creating dementia-friendly recreation and creating that community for folks with dementia. So if that is something you're experiencing as part of Parkinson's, or if your loved one with Parkinson's is also experiencing dementia, I really do recommend that you look for those resources in your communities, because there are others out there like you or like your loved ones who are wanting to connect and would welcome your engagement with them. All
Kate,
right, folks. Any last comments? Yeah, Maureen.
yeah, I just wanted to add, I love what you're saying. And, individuals with dementia or cognitive impairment of any kind, often our friends and our family and neighbors, because that person might not be very communicative or responsive to phone calls or even social invitations, we end up withdrawing. And I have to just encourage you to not give up, to
Yeah.
keep trying. Even if that individual is not very communicative, come over with a photo album or a picture, maybe when you were in high school or college, or bring music you used to listen to when you were younger, and listen to the music together. The amount of enjoyment they may be receiving may not be reflective in how they're responding to you. So don't take their physical or lack of conversational responses personally. Please keep trying. Again, you should take action also if you have someone in your life or in your community, because people with cognitive impairment may not be able to articulate as well as they used to, but the emotions are there, the feelings are there, and that feeling of being loved and cared about is there. So don't give up. And you may not get immediate responses, but it is absolutely important that the people continue to know that we care about them.
Absolutely. Thanks for that, Maureen. I really appreciate it. All right, folks, that is going to wrap up our session. Thank you so much for being here today, to all of our wonderful panelists and to everyone who's joining us in the audience and in the chat. We're so grateful for you joining us today. This is a really important conversation, and I'm glad that you're a part of it. Just so you know, this session was recorded, so it will be available to view on demand on APDA's YouTube channel if you want to watch it again, or if there's someone you want to share it with. While you're at our YouTube channel, be sure to check out all the other episodes of Unlocking Strength Within and our other educational webinars. And if you're in the US, be sure to reach out to your local APDA chapter for in-person events, support groups, exercise classes, as well as, information and referral services. Remember that APDA, we are here to provide you the support, education, and research that you need to live your life to the fullest with Parkinson's disease. We're always going to be here for you. All right, folks, take care, and we will see you next time. Bye, everyone.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson's Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.